COVID-19 has now killed about as many Americans as the 1918-1919 Spanish flu pandemic did, which is approximately about 675,000. The US population a century ago was just one-third of what it is today, meaning the flu cut a much bigger, more lethal swath through the country. But the COVID-19 crisis is by any measure a colossal tragedy in its own right, especially given the incredible advances in scientific knowledge since then, and the failure to take maximum advantage of the vaccines available this time. Like the Spanish flu, the coronavirus may never entirely disappear from our midst. Instead, scientists hope it becomes a mild seasonal bug as human immunity strengthens through vaccination and repeated infection. That could take time. For now, the pandemic still has the United States and other parts of the world firmly in its jaw. While the Delta-fueled surge in infections may have peaked, US deaths are running at over 1,900 a day on average, the highest level since early March, and the country's overall toll topped 675,000 on Monday, according to the count kept by Johns Hopkins University, though the real number is believed to be higher. Winter may bring a new surge, with the University of Washington's influential model projecting an additional 1 lakh or so Americans will die of COVID-19 by January 1st, which would bring the overall US toll to 7,76,000. The 1918-1919 influenza pandemic killed 50 million victims globally at a time when the world had 1/4 the population it does now. Global deaths from COVID-19 now stand at more than 4.6 million. The Spanish flu's US death toll is a rough guess, given the incomplete records of the era and the poor scientific understanding of what caused the illness. The 675,000 figure comes from the US Center for the Disease Control and Prevention. The ebbing of COVID-19 could happen if the virus progressively weakens as it mutates and more humans' immune systems learn to attack it. Vaccination and surviving infection are the main ways the immune system improves. Breastfed infants also gain some immunity from their mothers. Under that optimistic scenario, school children would get mild illness that trains their immune systems. As they grow up, the children would carry the immune response memory so that when they are old and vulnerable, the coronavirus would be no more dangerous than cold viruses. The same goes for today's vaccinated teens. Their immune systems would get stronger through the shots and mild infections.